Hi, Randy. Thank you for accepting my invitation to facilitate a workshop for the International Society of Hypnosis.
Thank you, Annette. I'm really happy to be on this, and I'm very honored that you asked me. I feel very humbled because I just did a little thing compared to many others in these hypnosis classes, but I would really like to participate with the things that I have developed over the years in my field of practice.
Thank you, thank you. But you're well known and renowned in this subject worldwide. So I know that our audience know you, but it's a tradition that I introduce the speaker a bit in this interview. So I should say that Randi Abrahamsen works in her private hypnosis clinic. She's a dentist and a PhD, and she served 10 years as a board member of the Danish Society of Clinical Hypnosis, 2 years as its editor, and 2 years as president. She is currently a board member of the European Society of Hypnosis and the president-elect of the society and chair of the Committee of Education of the educational program and chair of the research committee. It's quite a lot. How are you doing with these duties and responsibilities?
Sometimes it's a very heavy weight on my shoulders, but I like to do this job, and it's my way of giving back that all the things that hypnosis has given me in my life, I can help to promote it more out there. So I sometimes I'm tired, but I keep on working, and I hope it will engage other people in it.
Great, great. Okay, I know that the topic of your presentation, your workshop, is treatment of bruxism and chronic orofacial pain with hypnosis. So what are you going to teach us in this workshop?
First, I'll just go through a little bit about the research that I have done within this field when I was a researcher at the University of Aarhus. And then I'll just go on to the clinical practical way I've been working with hypnosis. And if somebody would volunteer to play a patient, I could do that, and I can give a full demonstration for all the audience how I use hypnosis. It will be with many practical things that you can use. Because I'm a dentist, so I've always worked with things in a very safe way, just building on developing resources. It's my opinion that this is helping people no matter what the symptoms they have. It's the way that you can work with hypnosis very safely, and it helps.
Great. Yes, exactly. And I know that the chronic orofacial pain is quite common, isn't it?
Yeah, it's very common. It's about 25% of the population, so it's a major problem. And sometimes, for example, doctors and psychologists don't know very much about this, that if you grind your teeth, like the bruxism, you get pain in your muscles, you get pain, and you have like a chronic pain situation, and you get more headaches and you get even more migraines. So if you'd help with the bruxism with hypnosis, it also helps with the headaches and the migraines.
Okay, and I know that it disturbs also sleeping.
Yeah, it's a way it happens always when you sleep. You grind when you sleep. And
Yes, exactly.
it's a habit that is unwanted and unconscious, and that's why hypnosis is quite good at this
Exactly.
problem.
Exactly. And is this a practical workshop or just we are going to learn something about the theories?
For me, I want to share a lot of the practical things that I have done and developed throughout the years.
Great, thank you. And I know that at the end of the workshop, maybe at the final part of the workshop, you are going to present a case of a 40-year-old girl with stuttering that you treated with the hypnosis. Would you please tell us something about that?
Yeah, it's because you could say as a dentist, it's a bit out, and this is very, you have to be within the ethical that you stay within your competence. But I live in remote part of the countries where you don't have enough doctors, you don't have enough health or anything. So I sometimes get approached by people, can you please help me? And I discovered over the years that just by developing the positive resources, it will help this. So I was asked if I could do something to help this young girl who was at the, she had one consultation with a speech therapist half a year ago, and she couldn't have one till 2 years later. So I thought maybe I can do something with hypnosis. And the only thing I did was just developing the positive resources in her. And we talked about what the stuttering was doing and when she did it. And I taught her to use self-hypnosis. And she actually turned up to be really good. She ended up, now she's singing in a band and going to a music competition and things like that. So it's quite good.
Great, well done. So I'm excited to know more about that case that you're going to present in the workshop. So Randi's workshop will be on Wednesday, July 10th from 5 to 8 p.m. Central European Time. So I invite all the people who are interested in the subject and who are a therapist, of course. Either they are a member of the ISH, I mean International Society of Hypnosis, or they are not a member of ISH. All the people who are a therapist can participate in the workshop. So I thank you, Randi, very much for accepting to participate in this interview, and I'm looking forward to participating in your workshop.
Yeah, I'm looking forward to be there as well. Hope to see a lot of people. It would be really nice. See you.
We will. Thank you. Bye-bye.
Bye.